So I'm Dr. Rita McGuire. I want to welcome all of you. I am here at the hospital. I'm on call every Wednesday night, so you can um, be assured that I am the resident OB-GYN. I'm the laborist, so if any patient comes in labor, any patient comes in and needs a surgery, an ectopic pregnancy, a torused ovary, I'm the person that has to take care of it. I'm also the Chief Medical Officer here at Wakanna and one of the co-founders. I represent the pillar of health. You know, we have 4 pillars here at Wakanna: health, wealth, legacy, and freedom. And I'm responsible for really bringing content, information, education about CBD, about our products and how they work. So as an OB-GYN physician, I not only deliver babies, but I do surgery. So on the left, I'm doing a hysterectomy. On the right, I'm doing some cosmetic surgery. But yes, I'm still a practicing physician. And truly, the last 30 years have been just so amazing to bring life into the world. 4 years ago, I was introduced to CBD. I was introduced to CBD by our CEO, Melissa Boston. 4 years ago, I didn't know what CBD was. The only thing I knew about cannabis was through my children. I have 3 adult children now, and pretty much I knew cannabis, weed, marijuana, getting high, but I didn't realize that there was a part of the plant that actually had medicinal benefits for health and wellness. I was also asked through this journey, after really studying and being an expert in the field of cannabis, I was asked by the governor of the state of Illinois, which is the 11th state to adopt adult use cannabis laws here, to testify, to really talk about patients that I've had in my practice that have been benefited through this plant. Benefits range from helping with anxiety to helping with pain, helping with very rare disorders and even autoimmune conditions, assisting with those who have severe nausea and vomiting, who may have cancer or undergoing cancer treatment. So I was just so honored to be able to help other politicians and lawmakers understand how important this plan is to our overall health and wellness. And I don't know if you caught this on CNN tonight, but there is a draft, there is a bill, a draft of a bill to decriminalize cannabis on a federal level. And you know, these are small steps, but these are important steps, because decriminalization is just as important, or not more important, than legalization. You know, those are 2 different things, right? Decriminalization means that, why did Shari Richardson get penalized and not able to run in the Olympics? Because they found THC in her urine, while others are able to do that. So decriminalization is going to be a federal bill that is going to be discussed. We still know that on a federal level, marijuana is illegal, but many states have legalized marijuana. But we know the long, many years of Black and brown communities being held on a different level when they're caught using or selling this plant. So just something that I wanted to throw in tonight's discussion, to look out for that bill. So let's move into what CBD is. There are many guests on the line, and you may be like me. Honestly, I did not know what CBD was or what it stood for. So CBD stands for cannabidiol, and cannabidiol is one of the many cannabinoids or compounds that the cannabis plant makes. And CBD can come from either marijuana, which gets you high, or it can come from the other species that I was really unfamiliar with, and that was the hemp species. So when CBD comes from the hemp species, not only is it legal on a federal under the 2018 Farm Bill and the state bills, but it doesn't get you high. And it doesn't get you high because CBD coming from hemp has very small amounts of THC. In fact, by definition, hemp is defined as containing 0.3% or less of THC. Excuse me. When we look at marijuana, marijuana has a high level of THC and very low levels of CBD. And this is the reason why marijuana gets you high and hemp doesn't. So yes, cannabis is the family. It has 2 species. I think I ate too fast. It has 2 species, the hemp and the marijuana species. Marijuana being the one that gets you high, and hemp gives you the health without the high. When we look at how cannabis works in the body, be it marijuana or hemp, it's a very interesting science. And this science is called the human endocannabinoid system. Another thing I had never heard of in my life prior to 4 years ago. This system was discovered when I was in medical school. I trained at Wayne State School of Medicine in the early 1990s. And this was discovered in the early 1990s. And this system is a vital regulatory system. And every single human being has this system. In fact, every vertebrate has this system. So if you have a spinal cord, you have this endocannabinoid system. And this system, whole vital regulatory role is to keep our body in balance, keep us in homeostasis, to keep us free from pain, keep us free from inflammation, keep us free from depression, anxiety, keep us free from stress, keep us free from having such bad symptoms that can be caused when we have conditions like lupus and fibromyalgia and multiple sclerosis. Not that this system can cure those things, but this system regulates and modulates many, many symptoms that folks have that have many conditions that face us today. So when we talk about conditions, they can be conditions like hypertension, high blood pressure, or diabetes. They can be conditions like herpes. It can be conditions like lupus. They can be conditions like gout. They can be conditions like regional pain syndrome. They can be conditions like psoriasis or eczema or acne. And why the list is so exhaustive is because our body has receptors in almost every single organ and gland in our body. So those receptors' main role is to bind with the cannabis or the CBD, send a message to that part of the body that has been knocked out of balance. So this system is really profoundly important, that not only that we understand that this is the reason why cannabis works so well in our body, but that we all need to understand that we have an endocannabinoid system and we all need CBD in our lives, right? Because our body is knocked out of balance because of the air we're breathing, the water we're drinking, the processed food we're eating, the McDonald's, the Harold's Chicken if you live in Chicago. I'm not raising my hand because I had Harold's Chicken. I haven't had it in probably a year or two. But all of these processed foods and foods that are in fast food restaurants, along with the stress of this global pandemic, the fact that we're not sleeping well, we're not in a state of well-being. There's a lot of uncertainties. Now we've got people who don't want to get the vaccines, people who do want to get the vaccines. And on top of that, now we've got 2 new variants. a Delta variant and a Lambda variant. I mean, we've got so much to process that this system gets out of balance. And when it gets out of balance, we start to have disease. We start to have pain. We start to have anxiety. We start to have depression. So when we look at all of the compounds that the cannabis plant makes, it's CBD. As you see here in this diagram, it's CBD that has more medicinal benefits than any of the other cannabinoids around. So when you look at CBD or cannabidiol, it's an antibacterial. And what that means is that any condition that can cause a bacterial infection, it can be acne, it could be, have you seen people who go to the barber and they get their hair cut, folliculitis, they got those bumps in the back of their head? It can be any bacterial infection. CBD can address that. CBD also inhibits cancer cell growth, meaning that when someone has cancer and it starts to grow and metabolize, studies have found that CBD can help to stop the metastasis and the growth of that cancer. Pretty interesting. CBD is neuroprotective. That means it protects the nerves. Any nerves that are damaged. Nerves can be damaged because you had a car accident. Nerves can be damaged because you have inflammation around the nerve, like sciatica, or it can be damaged because you have high sugar levels, you're diabetic, you have neuropathy, you've had a stroke. I mean, there's so many conditions where we need CBD to protect our nerves that have been damaged. CBD also reduces seizures and convulsions, epilepsy. That's one of the main reasons why CBD, cannabis as a whole, became mainstream, because of a little girl who was having seizures. Her parents gave her CBD and she stopped having so many seizures. It also reduces blood sugar levels. It does that for diabetics by reducing inflammation in the blood vessels of the pancreas. It also helps to reduce the function of the immune system. You know, I always tell this story. When I was in medical school in the early 1990s, I had never, ever seen a patient with lupus. Only read about lupus. I've only read about multiple sclerosis. In fact, one of my classmates had multiple sclerosis. That was the closest I saw to a patient. So now we're seeing 1 out of every 4 people have an autoimmune condition. So it's very, very common. So CBD can help to reduce the hyperimmune state that those people suffer from. And when they suffer from a hyperimmune state, they have a lot of pain, they have a lot of inflammation, they have a lot of muscle spasms. CBD also reduces inflammation. It's an anti-inflammatory. It's a more powerful anti-inflammatory. They say it's 20 times more powerful than you taking Motrin or Aleve or ibuprofen. You can put that stuff away because CBD is 20 times more powerful as an anti-inflammatory. It also reduces the risk of arterial blockage. So when we have a lot of fat, cholesterol that starts to block our blood vessels, we then develop coronary artery disease, which then can lead you to have an issue where you need triple bypass or quadruple bypass. And unfortunately, my mom did not recover from her triple bypass surgery and passed away 6 weeks post-op. So CBD is very instrumental in reducing the blockage of arteries. It also helps to reduce small intestinal contractions. It helps the gut in reducing inflammatory bowel disease, ulcerative colitis, Crohn's disease, diverticulitis. All of those inflammatory conditions of the intestine causes it to contract. It also helps to relieve vomiting, nausea. You know, when we talk about those who have chemotherapy treatments, radiation, even treatments that they're giving folks with autoimmune diseases, cause a lot of nausea and vomiting. So CBD can be used instead of your Reglans or your Zofrans, those antiemetics. It also helps to relieve pain. Again, CBD is an analgesic. It is about 20 times more powerful than your Tylenols for analgesics or pain relief. It helps relieve anxiety. It slows bacterial growth. It helps to suppress muscle spasms. It's relaxing, it's tranquilizing. It treats psoriasis, skin disorders that can cause from inflammation and bacterial infection. It's vasodilatant, a vasorelaxant, so it dilates the vessels. So you'll see those who take CBD and have high blood pressure, such a profound effect in helping to reduce their high blood pressure because CBD comes in and relaxes the vessels. There are other cannabinoids or compounds that the plant makes that you should know about, like CBG and CBC and Delta-9 THC and the new kid on the block, Delta-8 THC and THCV. They all come together and synergistically really help the cells and to maintain not only homeostasis, but actually help to improve the quality of life of you and many, many people that you love when you introduce CBD into their life. So when we sum it all up, the medicinal benefits of CBD are many. There are many, many medical issues that CBD can assist with. There are many, many disorders that CBD can assist with. Remember the picture I showed you on how CBD works and other cannabinoids work in the body. They're receptors from your head to your toe. So if you think about every organ, every gland from your head to your toe, and you think about different conditions that have been affected by those different organs and glands and nerves, you can realize how CBD can be very effective in assisting. It's almost like having another tool in your toolbox, not to replace or substitute medications you're on, but be another tool for those who are looking for a natural, organic, holistic way of addressing their health. So here at Wakanna, we have such an elaborate lineup of very safe and effective CBD products. All of our products are sourced from the hemp species, not the marijuana species. All of our products are safe and effective because we test our products. We have smokables, we have tinctures, we have edibles, we have topicals, we have hair care, we have products for sexual health. We have essential oils and sanitizing products to keep your home, office, and other areas safe. A disclaimer, now the FDA does not approve of any of these statements, meaning that we can't make claims that our products will cure or mitigate any condition that you may have. But just know that the research has been done. Cannabis has been used since 2737 BC. It's been used for centuries. And also, if you are on medication, if you're under a doctor's care, if you're nursing, if you're pregnant, please consult with your physician before using CBD. Now, it doesn't mean that you can't use CBD, but it just means that there are some medications that may, because CBD is metabolized by your liver, there's some medications that you may be on that are metabolized by your liver that we don't want to increase or decrease the effectiveness of that medication. So just check with your physician. If your physician doesn't know anything about CBD, send your physician my way. I'll share my email and we can get his or her questions answered. Now, tinctures are a great way to get CBD into your body. Tinctures are oils that you hold underneath your tongue, and I like using a twice-a-day dosing for tinctures because tinctures will last anywhere between 6 and 8 hours in your system. So tinctures here at Wakanna come in two forms. We have our power tincture, That's our our full spectrum tincture. And full spectrum means that those products contain the legal limit of THC, which is 0.3% or less. It doesn't cause a high, but it could potentially show up in your drug screen. Our pure tinctures or pure products are the broad spectrum products. So any product that's in a white label and you see the word pure, those are safe products for you to take if you have random drug screens. They contain less than 0.0% of THC. Both have amazing results when you're looking for a natural and holistic way of addressing your health. Just one is for those who have random drug screens. That's the pure. Now, our Power 500 milligram is one of our most sought after products, right? It is sought after because it is enhanced with essential oils. So the formulators here at Wakanna went a step higher and enhanced the CBD with turmeric, black seed, and peppermint. The reason why that is so important for you to know that this has a proprietary formula is that those essential oils help to improve the rate of inflammation in the body. It actually helps to improve digestion, kidney function, liver function, cholesterol function, and hair growth. That's the black seed part, the turmeric part with the inflammation. And then the peppermint not only addresses inflammation, but it gives the product a nice taste. I love peppermint, so I love the Power Hempranium 500 milligram. The next product is our pure product. That's our broad spectrum product. It's 300 milligrams in a 15 ml bottle. It's a great product because it has nanotechnology. Nanotechnology just means that this product and the way it is used or chemically, it is making the CBD molecule more water soluble, which makes it more available to the cells. It's called nanotechnology. It's able to get into the cells at a 98.7% bioavailability. So pure, again, is for those who have random drug screens. Our next product is our water soluble, the 500 milligram Power Water Soluble is a product that you can put in liquid. Because oil and liquid don't mix, you want to use the Power Water Soluble when you're using the CBD product in your water, your juice, your tea, your smoothie. It's another great way to get CBD in those who have cognitive dysfunction or they have dementia. They may have some issues where they can't remember to hold the oil underneath the tongue for 60 seconds. That's our Power Water Soluble. That product, you want to shake it. You want to make sure you keep it in the refrigerator so that it maintains its potency. The next product is our Hempranium MD, our Power MD. It is our most potent product. It is a tincture that you want to use for those who have more serious challenges. It is a product that really works well for those who have quality of life issues, meaning, you know, they used to be active, but that arthritis has them down so bad that they can't enjoy walking anymore. They can't enjoy doing yoga. Just quality of life has been diminished. So I really like using this product, the Hemp MD, for those more moderate to severe conditions. And then our Hempowered Hair is another tincture that can be placed underneath the tongue. It's a great product for alopecia, which is hair thinning or hair loss. You know, if you're menopausal, you should be on this product because during menopause, our estrogen and progesterone levels decline. When our estrogen and progesterone levels decline, not only do we get kind of crazy sometimes with the hot flashes and mood swings and all of those horrible menopausal symptoms, but we have hair loss. Our hair starts thinning. Our hair starts falling out. And so Empowered Hair really is a great product for every baby boomer, menopausal woman on this line. It's a product that can be used by men because men go through menopause. It's called andropause. So men go through it too. They have hair thinning, hair loss as well. Our products also come in a smaller volume, a 5 ml bottle. So you can get that power Hempranium in a 5 ml, and you can get the pure in a 5 ml. Those are great ways to kind of sample products before you buy the 15 ml per bottle. So those are our tinctures. And again, the benefits of tinctures are many because in that 500 milligram power Hempranium, we've enhanced the CBD with black seed, turmeric. Of course, we use our carrier oils, MCT coconut and hemp seed oil, and of course, peppermint. Our topicals. Our topicals offer local relief for those who are looking for relief due to inflammation, due to pain, maybe muscle spasms. Our topicals include our Extreme Power Pain Cream. It comes in a 400 milligram or 200 milligram dosage. We also have our Relief Topical 500 milligrams and our Dr. Rita's Rub, which is 200 milligrams. Now, the difference between these topical products that we recommend that you use for inflammation and pain is the formula, quite honestly. The formulation in the Power Extreme uses about 8 essential oils in addition to the CBD to help enhance the inflammatory process that's going on when we have pain. The Relief 500 has about 6 essential oils that are enhancing the CBD. And then the Dr. Rita's Rub, the Power Liquid Relief, has about 19 essential oils. So you can see that the formulas are all different, the milligrams are different, and quite honestly, I use all 3. I use the Power Relief at night. I like that Power Extreme Relief just to set in those sore muscles. I use the Dr. Rita's Rub during the day. I carry it around in my purse and I'm able to just rollerball it on. And I like the 500. I like the 500 sometimes post-workout because it gives you that menthol cooling feeling. So different ways of using the Extreme. Again, I like to layer my topical Extreme. I like to do one at night, one before, and then one after my workouts. So use all 3, see which one works the best for you. We have other topical products like our Power Body Mango Cream. It's a great, great product for those who want to maintain the texture of their skin, those who want to prevent aging, wrinkles, and those who have some conditions that they want to get some assistance with, like psoriasis, eczema, and acne, to name a few. Then we have our Holy Glow, which is our facial serum. CBD, remember, as well as the other cannabinoids have receptors. Remember I said from our heads to our toe. Our skin has receptors too. This is a great anti-aging product that uses CBD. I use all the products. I use this on my face twice a day. It's a great way to help the collagen, the elasticity to be maintained, especially in those women who are getting more mature. I'm not going to say we're getting older, but we're getting more mature, right? Our Holy Glow, our Glow Naked, our oud oil is an amazing product. It doesn't contain CBD, but it's a great glow after the shower. You put that on, and it's a great way to maintain the moisture in your skin. We have other products that we're going to talk about in the sexual health. Their body butters, their aftershaves. They contain CBD, and then again, a great way to get into the mood and to do a nice massage. The topical benefits, again, with topicals, they offer local relief for those who are looking for a reduction in inflammation, a reduction in pain, all that Epsom salt and all that Bengay. You don't need any of that anymore when you have these amazing topical products. Now, our edibles, oh my goodness, next to my vape, my edibles are my favorite. We have gummies. We have gummies for those who have random drug screens at their job, or maybe you're just a person you don't want any THC in your gummy. So we have our broad spectrum, our pure gummies. We have our power gummies at our full spectrum that have the legal limit of THC, which is 0.3% or less. I personally use a broad spectrum during the day. Yes, today is Wednesday. I had to work with that wound nurse. I sure did. And I had to vape before I went to the facility. And I had one of my pure gummies before I had to work with her today. In addition to my phone was locked. So I had a lot going on. So I needed my CBD to keep me calm. The power gummies are full spectrum. They contain the legal limit of THC. I like using the power gummies at night to help me sleep. We also have our new Delta 8 gummies, our Flight 25 or our Flight 50. Delta 8 is the new kid on the block, meaning it's one of the new and more popular cannabinoids next to CBD, but it kind of acts like THC, meaning that it gives you a little bit more potency if you're looking for that potency in a gummy. So the Flight 25 is 25 milligrams of the Delta 8. Flight 50 is 50 milligrams of the Delta 8. Then we have our King of the Jungle. We have a product, we have a gummy that helps with stamina. It helps with libido. So it helps with your bedroom activities. Men and women can take this particular gummy. It's called King of the Jungle. So gummies take about 30 all the way up to maybe 90 minutes to get into your bloodstream. So you definitely want to eat the gummy in any circumstance at least 30 minutes to prior to feeling an effect. You want to make sure before you eat another gummy that you allow the gummy to get into your system, right? Because what you don't want to happen is that before you know it, you're down 4 gummies and you're not feeling the way you want it to feel. Okay, so start low, start slow. I don't think I mentioned with the tinctures, you want to start with 3 drops twice a day. All CBD products start low and start slow. We also have the flat belly gummies we're going to talk about later, and the flat belly brew we're going to talk about later, and our bitter tea we're going to talk about a little later, all in one slide. But we have something called our immune defense tea. Our immune defense tea does not contain CBD, but it contains organic herbs that really help to boost the immune system, to maintain our immune system. This is not over yet, this global pandemic. We're still in the COVID times, and we need to continue to do things and put things in our body that's going to help our immune defense to work at its optimal. So that's our immune defense tea. It is a tea bag, which you're going to soak in 32 ounces of water, and you drink 8 ounces every day for 4 days. It's just a great, great tasting tea. Again, the edible benefits have the same benefits that CBD has as you are addressing different issues, be it pain, inflammation, anxiety, depression. You need sleep, you need sex, you need good sex, you need enhanced libido. All of these are important when we talk about CBD. Our smokable products, I'm using the Hypnotic vape cartridge. I love the vape. I love the smokables because they work fast. Within 1 to 5 minutes, you're feeling the effect once you do 1 or 3 pulls. Our power products, as well as our Delta 8 products, our products, unfortunately, if you are undergoing random drug screens you don't want to use, they potentially could show up in the drug screen, but they're great products, again, for those same conditions: anxiety, pain, inflammation, lupus, multiple sclerosis, insomnia, gout, herpes, bacterial infections. Whatever we talked about that CBD can assist with, these products can do it quickly. Our Delta 8 cartridges are amazing. They come in different flavors. The Power comes in Raspberry Jane, or the Hypnotic gives you more of a peppermint taste. We launched our new Delta 8 pre-roll, our Flight 300. We have a CBD pre-roll, and we have premium flour. So we absolutely have something for everyone. Gen Zs, millennials, they love Delta 8. Anyone that loves Delta 9 THC will love the Delta 8 THC. Again, the benefits of smokables is that they can increase the bioavailability, they have a faster onset of action, so they can help an acute situation to be reduced very fast. Sexual health products, our number one seller is this Cherry Bliss CBD lube and our G-Spot CBD lube. The difference is the Cherry Bliss is edible. So if you want an edible product, if you want a product to help to reduce vaginal dryness, a product to help improve libido, maybe you're just looking for a product that will enhance the sensation during intercourse, these are the products for you. We talked about the King of the Jungle gummies. We have the soft and sensual aftershave. We have body butters that you can use for massage, or maybe you just want to use a body butter with CBD along with the Power Body Mango Cream as well, keeping your skin very soft and moisturized. The skin is the largest organ in our body. So again, any of the topical products, any of the sexual health products that you're using topically will not pass the blood-brain barrier. I did fail to mention that. Any topical product that is used does not pass and get into the blood-brain, which can get into your urine. So you're safe if you have urine drug screens to take any of our topical products. Our essential oils are also, again, like all of our products, organically sourced. We have tea tree, lemon, black seed, peppermint, eucalyptus, frankincense, essential defense, and first defense, and peppermint spray. These essential oils, outside of the first defense, do not contain CBD. The first defense nasal spray contains CBD along with essential oils. And what I love about First Defense is because it's applied right into the entry of many bacteria and viruses, which is the nose, you want to have this on hand. Again, this global pandemic is still in full force, and we want to really protect all the entryways that different viruses, bacteria can get in and keep our body and our immune system at its optimum. Again, essential oils have been used for centuries, millennials, and they really help to not only improve our health, it helps to detoxify our body, to boost our energy, to help with allergens, to help with a lot of inflammatory lung issues that many of us have, like asthma, COPD, and emphysema. So essential oils are amazing. Our culinary product are our spices. Our spices are our garlic fire, our flavor king, and our chili lime. They are infused with CBD. Our vegan butter is infused with CBD. You can put it on your toast and your oatmeal. And then we have a product that you can bake and cook with. It's called our Culinary Plus. You can bake and cook your favorite recipes as long as you don't bake or cook over 350 degrees. Again, the culinary benefits of CBD are the same. If you're just looking to consume CBD a different way one day and you just want to spice up things in your kitchen, but you still know that you are addressing inflammation or maybe anxiety or pain, whatever it is, you can do it with our spices. Hair care, I can't say enough about hair loss and hair thinning. Not only can it come from hormonal imbalances that we have as we get older, as women and men, but it can come from traction, from different hairstyles. You know, the new thing now is, have you noticed the new thing? These girls are wearing braids behind and down their buttocks. So these braids are pulling all this tension and weight on their hair follicles and causing traction, alopecia, or hair loss. So we have a whole hair care line called Save Our Strands that you want to introduce to these young girls who by the age of 30 probably won't have any hair left in their head if they continue to wear these hairstyles. Help them out. Bless them with our hair care product line along with our empowered hair. The benefits again of having CBD in a hair product is that it helps to reduce inflammation, it helps to reduce bacterial infection, it helps to regenerate the hair follicles so that that hair can grow. Our sanitation products, excuse me, they are, sorry, that's my colleague calling me, Dr. Okuji. Our sanitation products are products that are supplied from our sister company, our Royal Defense. They are our hand surface and sanitation, our Royal Defense produce wash, and our Royal Defense hard surface cleaners. These are great products along with the travel. I love, because I've been traveling a lot between Atlanta and Florida. I've been traveling a lot and I love taking the travel kits, which come with masks and hand sanitizer spray. So when I'm on that airplane, I can spray down the seat. I can spray down that dirty table that they never clean. Ew. And you just spray and let it dry. You don't need to wipe that off. Okay. So those are our sanitation products. They use quaternary ammonium. Quaternary ammonium is a approved CDC chemical for COVID-19 infection. These are just an overall recommended use. If I didn't say start low and slow, I can't say it enough. Tinctures, 3 drops twice a day. Gummies, you want to start low and slow, especially with those Delta 8. All of the directions are on the products as well as the website. The essential oils, if you want to use our essential oils topically, you want to dilute them with a carrier oil like MCT coconut oil. Topicals you can apply to any affected area, making sure that the skin is not open. Smokables don't need, excuse me, you don't need a lot. 1 to 3 pulls 3 times a day. Spices are 1/4 teaspoon per serving to spice things up in the kitchen. And the hair care and sanitation products you want to use as directed. But again, CBD, start low, start slow. More is not better. You don't need a lot. We want to move into our flat belly challenge. Our flat belly challenge is really an exciting time. We launched these products, the flat belly gummy. We really formally launched it on our Freedom Conference this past weekend. And it is a really good product that pretty much everyone needs. I don't know if you've noticed, but maybe you will, like I am. I just noticing how many people have a large gut. You know, how many people have stomachs that look like this? And overall, millions and millions of Americans are overweight, if not obese. And guess where they're holding their weight? They're holding their weight in their abdominal area. And why that's dangerous is a really, you know, when you see someone that looks like this and has a belly, it's a huge liability. It's a liability because this fat many times is visceral fat. It's around important organs like your heart, like your intestinal tract, your pancreas, your liver, your gallbladder. And particularly when this fat is around your heart, it makes your heart work twice, 3 times, maybe 4 times harder. It increases your risk of diabetes, this fat does. It increases your risk of heart disease. It increases your risk of cancer. It's just an overall liability. Having abdominal fat increases inflammation in your body, which can increase pain. It can increase the incidence of arthritis. So this is no good at all to have a belly that looks something like that. Huge liability. So we have formulated here at Wakanna a flat belly gummy that will address your GI tract, meaning addressing that fat that is around your intestines, which cause a lot of inflammation and other problems. So this package that we're offering includes our flat belly coffee. It includes our bitter, so it includes the flat belly gummies, 2 bottles, as well as the flat belly coffee, as well as the bitters. Now, let's talk about the bitter first, and then we'll talk about the gummies last. The bitters is a 4-day detox. And when you purchase your pack tonight and you get it in the mail, you want to start with your detox. You want to detox for 4 days. It's a 4-day detox where you take the tea bag, you put it in 32 ounces of water, hot water, and you drink 8 ounces every day for 4 days, or 4 ounces twice a day for 4 days. However you can get it down, get it down. It's going to cleanse your colon. It's going to detox your liver of all the toxins, and you may experience detoxing sort of symptoms. You may experience some diarrhea. You may experience some gas. You may experience some breakouts of acne. You may experience those uncomfortable feelings when detox occurs. Now, once you're done with that 4-day detox, you want to move into your flat belly brew and your flat belly gummy. Now, along with our bitters challenge, we provide you with the ebook with the different recipes and suggestion with meal plans, because what you don't want to do, you don't want to continue to eat the same way and think you're going to get results just because you're drinking tea, coffee, and eating gummies. Don't fool yourself. That's just not going to happen. You're going to have to change first your mindset. And once that mindset shifts, you're going to have to change your diet, and you're going to have to get active. It's a combination of all of those things along with these amazing products that are going to get you the results that you want to see. So this package is $159.95, and it includes 2 bottles of the flat belly gummies, 2 containers of the flat belly coffee, and a bitter. Now, we talked about the bitter and how you do the bitter. Now, the coffee, let's move to the coffee. It's an instant coffee. You can use 1 to 2 scoops in 8 ounces of water, hot water or cold water. And you want to drink the coffee twice a day. I drink mine in the morning, and I drink mine around lunch or so. You don't want to drink it too late in the day because there is a little green coffee bean in it, which has a little stimulant. But what this coffee does is that it helps to curb cravings for bad carbs and sugar, right? We want to get rid of the sugar. That's the whole reason for detoxing first. But we want to continue that because sugar feeds bad cells. Sugar is probably one of the worst things you want in your diet. And sugar can be hidden. It can be white rice, pasta. So we want to help you with that, and that coffee will help you curb your sugar cravings, curb your carb cravings, give you energy, and also help to suppress your appetite. Not so that you will not be eating, but suppress it so you're not craving those bad meals. You know, you start craving those healthy, green leafy vegetables. That's a flat belly coffee. You want to do that twice a day. Now, we're going to move into our flat belly gummies, and then we'll talk about the flat belly challenge. Oh, and guess what? I guess Dr. Rita was moving so fast that she forgot to add that slide. So the flat belly gummies are 50 milligrams of the CBD. It's a broad spectrum CBD. So if you have random drug screens, you can take our flat belly gummies. So I don't have the slide here, so you're going to have to just listen. It also contains caralluma. Caralluma is a big long word, right? But caralluma is a cactus from India. And this cactus was eaten by those who were going on long hunts. It'd be days, right? And they would eat this caralluma so it would suppress their appetite so they wouldn't be hungry on these long, long journeys. So this flat belly gummy has CBD in it and also has caralluma. It comes from the cactus in India. And not only does it help suppress your appetite, but it gives you energy so you can feel like working out. Not only does it give you energy, but it helps with weight loss by helping with the fat that is being stored, that bad fat. So that's caralluma. The other thing it has on here in this product that you should know is called berberine. Berberine. Berberine is another herb that helps to give you energy. It gives you stamina. It helps to reduce cravings and reduce appetite, and is a very great product and herb that they use in those who are looking to lose weight. And then the third ingredient that you should know that it has in here is something called chromium. Chromium is an essential mineral, and it absolutely is used a lot in weight loss products and helping with energy, with stamina, and helping to reduce the fat that is stored. So that's what the flat belly has in it. If you're wondering how it works, it's no magical potion. It's nothing that's a snake oil, but those main ingredients, the CBD, the caralluma, the berberine, and the chromium synergistically really helps you to have an effective way of addressing that flat belly. So again, you want to do the bitters first, get that out of the way, do a good detox. And then we're going to move on to the challenge. We have a flat belly challenge that's going to start August 1st. Now we know that the bitters challenge was amazing, right? Susan Wallace won all that money. And then I forgot who was the runner up, but I just know that you want to get in the game and win this money, win this cash, and win these products, and win this trip, right? So the Flat Belly Boot Camp Challenge starts August 1st. It goes into September, and September something. You want to register. You can register tonight because it's up and running. No, Dr. Rita can't read. The challenge starts August 1st, and it goes all the way to October 10th. You want to register for this challenge tonight. The website is up and running, www.gummychallenge.com. You got to register. There's no purchase necessary to win. You want to order your product, though. You want to get that package that we talked about, so you have all your products. You can detox first and get that flat belly brew in your gummies. You want to be a part of this because what you're going to be involved in are some really fun movements. We're going to have workouts. You're going to have your meal plan. You're going to get everything that you need to be successful to win. And to be successful to win, you really do need the products to help curb your cravings, to increase your energy. We've got so many fun things with the rebounding that Dr. Roz does every day. We have a 6 a.m. workout on Wednesdays with Ernestine Davis and Queen Neff and Dr. Roz. And then you probably have your own workouts that you can do at home or at your gym. So let's go over first place grand prize. Wins an all expense paid trip for two. Second prize is $1,000 in cash. And third place is $500 in cash and free products. So How do you take the gummies? We talked about how you take the coffee. We talked about how you do the bitters. You want to do one gummy about 30 minutes before your meal, right? So one gummy is 50 milligrams. You want to start low and slow. You may even want to start with half a gummy before breakfast and half a gummy before lunch, because many of you out there are layering your products. You're using the tinctures, you may be using the smokables. So you're getting a little bit of CBD in at other times, but just know to start low and slow. You can do one gummy or a half a gummy before breakfast and lunch. So those are the three products. That is the Flat Belly Challenge. Please go and register today, tonight at www.gummychallenge.com. Please connect with the person that invited you so you can order your package tonight, so you can get that package way before August 1st. You don't want to start August 1st ordering things, so that you can get that done. And then, of course, if you're on the line and you want to take part of all of the other products that we have, you can't go wrong because we have so many great choices. If you have other issues, other concerns that you want to address with our products, please connect with the person that invited you on the call. So it's 8:57. I am going to take some questions. If you have questions about anything, also somebody saw that on MSNBC about the decriminalization of cannabis on a federal level. Yes. Yes, Ernestine Davis says that she hates coffee. Can I put that coffee in your smoothie? Yes, you can, and it tastes so good. I'm a coffee drinker, but sometimes I put my coffee in my smoothie. And guess what Dr. Rita does sometimes? Dr. Rita sometimes puts coffee in coffee. Yeah, I put coffee in coffee. So sometimes I will put our coffee in coffee. So yes, if that makes sense to anyone, it makes sense to me, so I do it sometimes. The website is not working. Melissa Boston promised me that the website would be working this evening, Wednesday evening, the night that I went over the Flat Belly Challenge. It should be working. Can CBD help with vertigo? Vertigo, yes. Vertigo is an imbalance in the inner ear. It is a horrible, horrible condition. It is spinning, it is dizziness. And the way CBD helps with vertigo, it addresses the inflammation that is occurring in the inner ear. CBD also helps to reduce anxiety because vertigo can be very anxiety provoking. And then CBD will also help with sleep. So it's going to help with the inflammation in the inner ear that causes the vertigo. It's going to help with anxiety, and it's going to help with sleep. So yes, if you know someone that has vertigo, you want to get them on the Hempranium 500 milligrams. You want them to get 3 drops in the morning, 3 drops in the evening. You want to get them on a power gummy at night. And I would recommend having pure gummies during the day, as well as a cartridge if they have an acute onset of vertigo, and they can address it right then and there with 1 to 3 pulls on their cartridge. So yes, there's a lot of studies on CBD and vertigo. That's a really great question. I've already done a webinar, a seminar on CBD and vertigo. So we will make sure that you know where to go to get all of my videos on the YouTube so that you can see that information. What product would you recommend for someone with a pinched nerve in the shoulder? So pinched nerve in the shoulder, I would recommend our topical. I would use the Power Extreme at night, put it and apply it at night. I would use the Dr. Rita's rub during the day. I would do the Hempranium 500 milligrams tincture underneath the tongue 3 drops twice a day, and I would use the Power Gummy for sleep at night. I like using the Power Extreme Pain Cream at night because I like that cream just to sit and soak and to really reduce the inflammation. And I like using the Dr. Rita's rub during the day so I can just easily rub it on and keep it moving during the day. What exactly is the Flight 300 pre-roll? It's 300 milligrams of Delta 8 in one pre-roll. Please don't smoke the whole thing all at once. 1 to 3 pulls is all you need on that Delta 8. Go slow. See, Delta 8 is a cousin, is a relative of Delta 9, a really close relative of Delta 9. So if you're sensitive to Delta 9 THC, if you're ever in your past or in your other life ever used marijuana and you're sensitive, Delta 8 may not be the product for you because it's very potent. It's the next step up from CBD. But if you're someone that tolerated Delta 9 THC and you're able to handle it, then yes, go for it. The Delta 8 has really been helping people who are not finding the relief that they wanted to see in CBD. So it takes it just to that next notch higher is the Delta 8. Are the CBD oil tinctures as effective if you put a few drops in hot tea, or will the heat destroy the properties? So you don't want to put the CBD tincture in hot tea. You want to put your Power Water soluble in your liquid tea because oil and water don't mix, and so you'll just be wasting product and money. So use the Power Water soluble in your tea. Oh, if I have a picture of my weight loss side by side, let me see where that is. Yes, you are right. Ernestine Davis is reminding me that yes, Dr. Rita had a belly. Does anybody want to see it? Well, let me find it. It should be right here. Give me a moment. Yes, Dr. Rita, here it is right here. And you know what? Nobody told me that I looked like this. This is what the problem is. I tell my family, why didn't you tell me? So yes, this is Dr. Rita. I had a big stomach there. I was 2 pounds shy of 200 pounds. This was 7 years ago. I lost 67 pounds. That's when I started my journey. Started my journey about 7 years ago at the age of 52. I'm 59 now, and I feel amazing. And I truly, was headed for premature death, right? I had all that fat around my belly. I was under a lot of stress, working 96 hours a week, 3 children, single mom, horrible diet, sleep deprivation. I was just a hot mess. So yeah, you can absolutely get rid of that belly. The belly is, they say it's all about the belly and the kitchen. It's not really how many sit-ups you do, but that's why with our flat belly gummies, we provide you with a meal plan, because the stomach and that fat that accumulates there is all bad carbs. It's all sugar. It's all the horrible things that you're eating in your kitchen. So you lose the belly in the kitchen. Abs are made in the kitchen. That's what it is. I knew it was something, Ernestine. I couldn't think of it. Let's see. Okay, yeah, Ernestine, you put me on blast. I didn't know I had a big belly. You were the first time. No, I'm only kidding. Let's see if there's other questions. The vape oil cartridge is not listed on the website. Why? It should be. And if it's not, it could be just a technical thing that's going on right now. I did not look at the website in the last couple of hours, so we will check that out. The vape oil cartridges, that question was answered. Any other questions? Sciatic nerve was answered. Thank you from Brenda, Virginia, the vertical question. We answered the Flight 300. Yeah, that website should be up this evening. So give it a couple of more minutes because Melissa knows that I'm finishing this call at around 9. Are CBD vapes overall safe? Heard they have other properties that are bad for you. Great question. So our CBD vapes are very safe. Our CBD vapes are different from the e-cigarettes and other vapes that you heard about in the news last year. Those CBD vape cartridges had vitamin E as a carrier oil. Vitamin E can be very toxic when it's heated to the lungs, and that's really was the culprit on why so many died from vaping. It also, the FDA also did investigation of those vape cartridges, and what they found was not only vitamin E, but they found fentanyl, they found different other opioids and narcotics. They found rat poison. They found a lot of very dangerous fillers that they were putting in products. So Wakanna products, we don't have any of those dangerous fillers. We don't use vitamin E for our carrier oil. We use MCT coconut oil. Our products are safe and effective. Wonderful. Any other questions?
Hey, Dr. Rita.
How are you, Dr. Betty?
I'm awesome, thank you. So I just wanted to mention that not only is the fat belly a kitchen issue, it's also a stress issue. And when we are stressed, our bodies produce a lot of cortisol, which concentrates in the belly area. So CBD and our wonderful products also help with stress management because they allow us to be more relaxed, to be less anxious, and therefore help in reducing the cortisol production in our body.
Yes.
Yeah.
Cortisol is no friend of ours at all. Thank you so much, Dr. Betty.
You're welcome.
Thank you so much. Just, you know, when you think about CBD and all the things that it does, you really cannot go wrong with offering, suggesting, sharing, blessing others with our products, because people will tell you, oh, I sleep fine. Oh, I'm not under stress. Oh, I'm whatever, right? But we all need CBD. We all need CBD to keep our body in balance. We all need CBD to help us sleep better. We all need CBD to help us feel more at peace and have better moods. Even if we're not on medication. I'm not on any medication, but I use CBD to address issues that can occur acutely, to address issues of inflammation and pain, to address issues to keep my endocannabinoid system in balance, because I do know of all the external environmental stress that's on all of our bodies, right? We can't keep ourselves in a bubble. We've got to breathe the air. We've got to drink sometimes water that, I'm a water snob, that may not be the best water. Sometimes we're in situations in restaurants, etc. We know that this global pandemic has just put a stress on all of us. So we all need CBD. So if you are a guest on the line, please connect with the person that invited you so you can get these amazing products in your hands, so that you can be a part of our Flat Belly Challenge, so that you can be part of the movement that we're really trying to end the negative stigma about this plant, and that it really offers a lot of health to so many that we love and that we know. So with that being said, it's 9:10. I did go over. I'm sorry that it went over, but you guys have been a great group as usual. Be well, be safe, and we will see you next week. Just look out for that website. It'll be up and live very soon. Have a great night, and I will see you next time. Thank you, Dr. Betty. Thank you, business partners. Thank you, guests. You guys are amazing.